Welcome back from the break. I am really excited about this next session, which is going to focus on storytelling as a powerful tool to drive advocacy and shape health policy. And we're really going to be building on the discussions from yesterday as well as today. And yesterday, if you recall, we had a session on real-world evidence and unlocking the potential of data as part of advocacy effort. We're also going to consider how we can take something that each of us has, which is our own story, to engage media and influencers and different audiences, and ultimately drive action and change for patients. For the first talk, I'm really excited to welcome Warren Fernandez. Warren is CEO of Edelman in Asia Pacific. Edelman is the world's largest independent marketing and comms agency. And prior to this, Warren was the editor-in-chief of Singapore Press Holdings and the editor of the Straits Times, which is Singapore's main English daily newspaper. Warren is going to talk to us about the role of media, share his personal experience and what does and does not resonate with journalists. And he's also going to talk to us about how to work with journalists to influence health policy decisions. So over to you, Warren. Welcome.
Thank you, Ruth, for the introduction. I'm really delighted to be here with all of you at this APPIS Summit. Thank you for the invitation. As you know, I've been a professional journalist for most of my life, and I've had a stint as a health reporter. I played a role as news editor, and then editor-in-chief. And I think the one consistent thing through it all is the power of storytelling. So I thought that for today's discussion, I would keep it very real by sharing with you a real-life case of a story which I was involved with when I was editor at the Straits Times, which was about the experience of a elderly gentleman. If I can have the next slide, please. His name is Mr. Xiao Ban Yang, who went through quite a harrowing experience. He had to go for an eye surgery at a national healthcare facility. He thought it was a highly subsidized facility. But because of the way that the treatment was priced by the state hospital and the way the state insurance system worked, he ended up getting a very small subsidy. And of course, at his elderly age, that came as a huge shock to him, a big challenge of how to pay that bill. But it also led him to wonder how many other patients were caught in a similar situation like himself. So here is a real life example of a patient telling his story, going to the media and working with the media to get that highlighted, and then making a big change in the way healthcare subsidies are worked out and insurance payments are made. So let's hear from him himself, and then I'll come back and talk more about him. Can we see the video, please?
We are all under the impression that you can claim quite substantially from MediShield. But when I got the bill, I was quite shocked. After the government subsidy, I could only get $4.50. I said, that looks very ridiculous. I was wondering, how do I get people to know that I got $4.50 only? I thought, well, the best way is to get through to the media. Then I remember there's Selma, the senior health correspondent, and she's the best choice to reach the public. Sama did a wonderful job of covering my case. It seems there's a lot of response from the public, not happy about the $4.50, and there's a chain reaction after that, you know.
Thank you. So there you see the case of an individual with a powerful story to tell. He contacts Salma Khalid, who was a senior health correspondent at the Straits Times, where I used to work. And Salma is a demanding reporter. She doesn't suffer fools lightly. She's relentless in pursuing her story. But she listened to this elderly gentleman in a dilemma, getting only $4.50 in subsidies and having a huge bill to pay. And that led her to dig and to find out more about what was causing this. How was healthcare being subsidized, and what the levels were being set at, and how was the claims being worked out by the authorities. She dug and she dug and dug, and the more she wrote about it, the more it generated discussion in the letters page of the Straits Times. It led to a huge debate in Parliament, and as a result of it, there was a major change in the way these operations are priced at state facilities and how claims are set by the authorities. So the net result was a good outcome, and it proved that there were many other cases like Mr. Xiao's who were being caught in between these two providers of healthcare and the insurance authorities. And so that was a good outcome, an instance of a powerful story told to the media, which then led to policy changes and benefited many, many thousands of people. So that's really what we are trying to do here. We're trying to sort of raise awareness through our storytelling to connect with others who might be in a similar situation, give them a sense that there are others who are also going through something like that, inform the public and educate them, and maybe build a community of people who are going through the same experiences and show them that there are others like them whom they can turn to for help if they need it. Next slide, please. So this is what we are trying to accomplish. We want to present clear, correct information to the media, get the stories out there, provide a personal perspective, and engage the audience beyond just a small group, but the broad sweep of the audience, and provide a patient voice, a story which is anchored around a patient, and hopefully motivate and encourage others to take action. Next slide, please. So this is what it's about. I mean, most of today's media houses are integrated across platforms. All newsrooms are on a journey to integrate beyond being just pure print. They are also doing websites and online products. They're doing radio programs, they're doing blogs, they're doing podcasts. Every media organization is at some point in that spectrum. What it means for us is that we need to understand the media organization that you're dealing with. Which platforms are they operating on, and how can you pitch your story to help them tell your story the most effective way? And I often refer to the 3 V's: video, voice, and visuals. You need to be able to help them with those 3 elements, because your story can then have legs across multiple platforms, and you should really be playing across the whole field, the whole spectrum of opportunities that is available to you in a modern newsroom. So understand the newsroom that you're working with, which are the platforms that they are engaged with, and then help them with the 3 V's that you need in order to get them to tell your story. Next, please. I summed it up as in a word: trust. At Edelman, we are big believers in building trust across organizations, across society, but each of the letters stands for something to help us. So what resonates with an audience, and what will get a news reporter or a news editor interested in your story? Firstly, it has to be something that is topical, something that people are talking about. So if you can relate your story to something that's going on in society, the more you're likely to get traction. It has to be relevant. You've got to make what you're trying to say connect with what the audience might be interested in. If they're concerned about rising costs, you can connect to that. If they're concerned about accessibility or long waiting times, see how you can connect to what is on people's minds, because then you're sort of swimming with the tide. It also helps if your story has a surprise element. It's unusual. It's not out of the ordinary. So if you can find an example, as in the case with Mr. Xiao, which was a very surprising case, that's where you will get immediately people paying attention and saying, what's the story about? How can I tell it? And then the third element is S, that's for story. We all love good stories. And the more you can personalize and humanize the issue, the information you're trying to get out there, the more you're likely to get interest in the newsroom. And lastly is that point of tension. If there is a policy question, if there's a disconnect, if there's a question being raised about why is this happening, or who's responsible, or who might be able to put this right, that's going to get everybody sitting up and saying, where's the story coming from? So remember the different platforms, the different styles of presenting your story, but also remember these trust elements, which will make your story so much more powerful. Next, please. And here, if you look at two sides of this equation, what is it you are trying to do as a communicator, and how does that relate to what the newsroom is trying to do as the medium in which you get your story out? You'll see some commonalities. Both sides want to inform, to educate, to explain. The one big difference between what you want to do and what the media wants to do is the importance of having compelling stories which will engage the audience. That's critical, because every journalist, every editor knows that the easiest thing for the audience to do is to turn the page, swipe up or left or right, and move on. So you've got to have a story which is compelling and which the audience will sit up and say, gosh, what happened to this poor Mr. Xiao? Why is this the case? Who else is being affected by this issue or this policy, and what can we do to help? So that engaging story and compelling story is what will make the difference between whether you get covered and whether you don't. And you really have to work with the media to help them to help you tell that story. Next, please. Here, I just summed up a few tips which you might remember as remember that when you're speaking the media is a conduit. It can help you get information out, but beware that it's your story. You own it, you tell it, and you should be in command of the facts and the information. Understand the questions, understand the issues that are coming at you. But remember, you have to control the agenda. You have to be the one shaping that story and that narrative. At all times, being mindful to help the media tell your story, but remembering that this is your story to tell. So you've got to stay very close to the facts and the figures and that outcome. And lastly, I have one last slide just to say, whenever I do these talks, I often say to people, one thing to remember when you're pitching to the media is that the sun will come up tomorrow. And what I mean by that is don't be too disheartened if you don't make it the first time, because there's always another day. There's always a new news cycle. There's always a different platform in which you can pitch. One of the earlier speakers said, don't be shy to tell your stories. And I totally agree with him, but my one addition to that is to say, be relentless. The more you pitch, the more likely you are to score a home run. And if you don't score one today, keep at it. Be relentless. Build relationships with the folks in the newsroom. Don't take it personally if they don't accept an idea today. Just keep going back with them and talking to them and telling them good stories and giving them ideas. At some point, I'm sure you will get traction, just as Mr. Xiao decided to pick up the phone and call Salma, and lo and behold, his story led to massive change in the way the issue was addressed in Singapore. So that's where I'll wrap up today and I'll take over and hand over to Ruth for some questions.
Thank you so much, Warren. That was such a practical yet poignant overview in terms of how we engage with the media. So I'm going to dive right into some questions that have come through. The first one says, how can we grab a journalist's attention with our email or our phone call? What can we say to help them engage right from the get-go?
I think it always helps if you have an existing relationship with some folks in the media. So it pays to cultivate a few key people in the newsroom, get to know them way before you need to approach them to tell the story. I think it makes a difference when the correspondent or the journalist has that story as his own, rather than it coming through a press release or a press conference. Because when there's ownership, they take a certain pride in it. It makes a difference if the journalist walks up to the editor and says, I've got this fabulous story, than if it comes the other way, the editor assigning it to the story. And this is just basic human nature, that ownership matters. So the more you can work with the journalist and give them the facts, the figures, the story, the pictures, the videos, the more you're going to get that traction from them.
No, that was a great the three letters you gave us, or the three words you gave us, starting with the V: the video, the voice, the visual, something that we can always remember as well. The next question that's come through is there a role for advocacy group leaders to educate journalists and media about disease topics? Because today, how do they get educated about topics around disease specifically that are quite fluid and change all the time?
Definitely. I mean, newsrooms are also resource staffed. Some newsrooms have dedicated health correspondents, some don't, some have generalists trying to understand. So you need to be aware that not everyone is as informed or as much of an expert in any given situation, any given disease or issue or topic. And you need to help them get up to speed fairly quickly. Because in a newsroom, you can be assigned a story in an instant. I'd get editors coming up to me to say, Warren, today, go cover this. And you have to then become an instant expert in that subject. And the more you have a friendly voice on the other end of the phone who you pick up and you call someone and say, help me understand this issue, help me get the background, the more the journalist is going to be grateful for that help. So I would say they would welcome help in understanding an issue, background briefings. And if you already have an existing relationship with them, so much the better. So definitely helping the newsroom tell your story is part of that process.
No, and that's so true. And I think it relates to as the overall theme of APPIS, which is about partnership, and that partnership is built over time. So having that relationship, I can see how that's also key. Maybe one last question. You've been in obviously the media space for a long time, now healthcare, speaking on healthcare and seeing it evolve, particularly in this region over the many years. Anything that you have seen that's remarkable when it comes to health in the media that also is sort of exciting about the opportunities that we have to really shape health policy from a media standpoint? What are some of the things that you've seen in terms of the changes in the landscape in media?
I think one of the big changes is patient awareness and access to information. Today, you and I have at our fingertips access to endless amounts of information about anything, healthcare, climate change, whatever. And that in a way is a boon and a bane, because patients can go direct and get information, but very often it's a mix. Sometimes they get information which may be inaccurate or complete misinformation, or it may be information that needs some expertise in understanding, and therefore can lead to confusion if you don't have that background. So here's where communicators can step up by making sure we take information, we put it in context, we put in the right background, we put in the right interpretation and the right backgrounding. And that's what will make the difference between a good story and a half-baked one. A good journalist understands the difference between the two. A good newsroom understands the difference between the two, but they need help. They need help from you as communicators. They need help from their editors in order to be able to take very, very complex issues and interpret it in a fairly short amount of time and short amount of space to tell that story in a compelling way, but in an accurate, reliable, and credible fashion as well. So the big change is that flow of information that's coming at all of us, how to distill it into a form that engages the audience, but at the same time conveys accurate and reliable information in a credible and compelling way.
No, really well said. And thank you so much for that session, Warren. All of the insights, like I said, and also the practicality of it, I think is going to be super valuable to us today. So thank you so much for joining us.
Thank you, Ruth. Thanks to everybody.
So next, I'm really excited to welcome Dr. Gia. That's what she likes to go by, I understand. Dr. Gia was previously a project consultant to the World Health Organization in the Western Pacific Regional Office, with a focus on healthy lifestyle in the workplace. And she's currently the head of Makati Medical Center's Women's Wellness Center in the Philippines. Dr. Gia is also a breast cancer survivor. And today she's here to share her personal journey from breast cancer advocate to storyteller. She's also going to provide some guidance on how you can strengthen your own story and experience to drive engagement and action. So looking forward to this next session, and a warm welcome to you, Dr. Gia.